Good to go?
Yep, I'm just starting the watch party in the group. Give me 1 second.
Okay. Yeah.
Yep, we're good.
Good morning, good afternoon, good evening. Namaste, namaskar, pranam, adab, sat sri akal, vanakkam. Hi. Welcome once again to the live chat on this Sunday.
Good afternoon, good evening.
And last time we had a very interesting guest, Mr. Ashok Chakradhar. And today we have a very different topic, but it's a very, very important topic that we'll be talking about today, and that is depression and suicide prevention. In the recent past, there have been instances where there have been deaths, unfortunate deaths, probably suicides. And we also see that there's a lot of depression everywhere. People are depressed, people are stressed out, and we get to hear the news about suicide every now and then. So it's a very, very important topic to be talked about, discussed, and solutions to be found. We have two very eminent guests with us to talk about this, Dr. Manpreet Khemka, who's a senior psychiatrist, and Dr. Kapil Kakar, who's a senior psychologist now. Let me tell you about the guest to begin with. Dr. Manpreet Khemka is a psychiatrist that holds a double board certification in adult general psychiatry and child and adolescent psychiatry. Along with a successful clinical practice, Dr. Khemka is affiliated in an academic role in teaching medical students, psychiatry residents, and nurse practitioners. Dr. Khemka is noted for expertise on medical, behavioral health, consultation liaison, child adolescent psychiatry, general adult psychiatry, and neuropharmacology. Besides this, she's a very good human being, and she's a friend of all of us, and she's also one of the hosts in the live chat. As she says that your host and those, Manpreet Khemka. But today, she's going to be and talk to us as a guest, as an expert. Our second guest is a very dynamic young man, Dr. Kapil Kakar. He's a very senior psychologist. He holds a PhD degree in psychology. He has more than 20 years of experience in clinical psychology. He's authored many articles in leading newspapers like Times of India, Hindustan Times, and all. He's authored 3 books now. It's a very interesting book on Gita. His interpretation of Gita is there, and fourth book is on the cards now, which is going to be on the increasing rate of divorces now. So I don't know whether this fourth book will make the divorce easier or more difficult. That he will tell us later on. And he's also a very regular panelist on the leading TV channels and talking about tough subjects like I remember he spoke about the Arushi murder case, the Nirbhaya case, and recently he was on TV talking about Sushant Singh's case also. So not very easy subjects to talk about, but he's bold and strong to come on the TV and express his expert views on that. We're fortunate to have him as one of our guests today. And before I move any further, I'll hand over the mic to Nupma, who will explain to us how to ask the questions. But we will have the questions in person rather than in the chat, Nupma. So please tell people about raising hand option.
Hi everybody. Welcome, Dr. Khemka, Dr. Kakar. Guests, everybody who's on the Zoom call with us, you have the option to raise your hand after Dr. Dhawan and the guests have discussed the subject matter. And everybody else who's joining us from Facebook and from Dr. Dhawan's wall and everywhere else, please post your questions and comments. We'll first take the Zoom questions, then we'll take the Facebook questions. And if there are questions left unanswered, we'll try and take them up in the live chat, the group. And Dr. Dhawan will share more details for the group for those who might not know about it yet. I guess that's pretty much it. We will all keep our videos and audios on mute while Dr. Dhawan and the guests are speaking. Dr. Dhawan, you can take it.
Thank you, Nupan. Thank you very much. And please note that this option to raise hand is there in the participants list. If you open the participant list, on the bottom you get this option to raise your hands. You can raise your hands anytime you feel like asking the question. We will take them towards the end of the show. So once again, welcome Dr. Manpreet, welcome Dr. Kakar on this show, and thank you for willing to talk about this very, very important and relevant subject. I'll ask you straight away a very blunt question that why do people commit suicide? And and we'll talk about other things afterwards. So, Dr. Manpreet, starting with you.
Okay. So it's a difficult question to answer. Why do people commit suicide? The factors can be multifactorial. It's not like a one size that fits all answer that I can give here. But one thing is for sure, when people commit suicide, mostly there is a mental illness associated with it. Again, it's like any other action. There is a strong motivation that a person is living with, and the motivation is to end their life. And why they want to end their life, the factors can be multifactorial. There may be clinical depression going on. Most cases when people end up committing suicide, there is a background of depression. Like we discussed the other day, 10% of people who are depressed commit suicide. So it's just based on what extent, what spectrum of their depression is. Are they dealing with severe depression, dealing with sense of that hopelessness, and they are stuck with this point of no return, irreversibility, which could be a factor where it's not more about ending their life. It's like they don't want to live that life anymore. That can be one factor. There, classically the theories which are there, they explain it as there is something inside that there is a hatred for. And in Freudian terms, they call it's a anger turned inwards, and which ends up in finishing life. Sometimes the factor may be the revenge factor, kind of proving a point that this is what you did to me and that's why I'm ending my life. Sometimes it could be the psychosocial stressors. Like recently there have been a couple of news where farmer suicide or people who have lost their job, murder suicide, where instead of seeing the family going through hardships, one person took life of the children and the wife and then committed suicide. So it's multiple factors. There is not a clear-cut answer I can give there. Sometimes it's, some organic pathology going on, something going on from the medical standpoint, which impairs judgment or makes somebody paranoid, schizophrenic. We see high risk of suicides in schizophrenics as well. So multiple answers.
So do people feel that they are seeking relief and some sort of peace and escape and deliverance in death when they talk of or think about suicide?
It's explained as a two-way thing. Like I said, the flavor could be two different flavors. Like one you mentioned, where there is a sense of calm and peace and acceptance that there is something beyond, which looks more, the grass is greener on the other side, something beyond which is more tempting, which is going to give me a break from the life that I'm living right now. So there may be that calm, tranquil quality of perception that can make somebody commit suicide. On the other hand, it could be that hostile, aggressive urge too. Either it's something that I hate about myself and my life. So regardless of what's on the other end, there is that aggression towards myself or aggression towards somebody who has done bad towards me, that revenge tone to it. So it's very two different polars we are talking about, but both of them can be factors that can lead to suicide.
And Dr. Kapil, what do you say? What are your views on it? That why do people commit suicide?
All right. So, like you started by saying you're asking a blunt question. Yeah. So, I'll try and give you a straightforward answer to it. How I see the whole thing. That there's always a sense of rejection. Whenever a person thinks of committing a suicide, one of the major driving force is a sense of rejection that has been pending up in that person for over a period of time. If you look at it, we all compartmentalize our lives into three compartments. So one is you, yourself, that is self. The other is the family, and third is the profession. And any of the three compartments of life, wherever there is a trigger of rejection, and when somebody is not able to handle it, it overlaps into the other compartment of life, say self, and from there to the family. And when it kind of goes out of hand, holistically, all the three compartments coming together is when the person actually starts getting into the mode of contemplating for suicide. So one of the important reason is because when there is a rejection, there's low self-esteem, there's low self-concept. The person is actually questioning himself. That is one. Second is, I have often seen people who would end up attempting a suicide or considering a suicide. For them, it is like, even if I go from this world, nothing is going to change. Nobody is going to remember me. Things will, and perhaps the people who think they're close to me or who I think are close to me would actually will not make any difference, or some of them would even be happier. So they, and to add to what all I said, I got a very interesting case just 2-3 months back, wherein a person, and this is going to perhaps throw another spectrum altogether, a very different one. A person attempts suicide, goes unconscious, is immediately taken to AIMS, and somewhere obviously the person is saved, and the person is then asked why the person commits suicide, and the answer is the person does not believe that the person actually attempted suicide. So that thing in the person's mind has totally, somewhere deleted from the mind that she actually attempted a suicide. And even today, after 2 months, the person cannot believe. So what I'm coming here is that when the rejection and the sources of rejection go to an extent, at times, it is at the spur of the moment when the person may take this drastic step, totally being out of control. So one is you consciously do it, the other is you impulsively do it, but impulsively does not mean it does not happen overnight. It is again a process which might take 6 months, 1 year, 1.5 years, when a person just might impulsively do it. I don't know whether I'm talking too much or not, but one thing I like to add on this, like Sushant Singh Rajput case. Now what happened there? Before he attempted, in fact, he committed suicide. Before he committed suicide, he called somebody late at night. That person obviously did not take his call. So that means whenever a person consciously would try to do something like that, the person is also looking for some kind of solace or some kind of help, some kind of support. And when at that impulsive state of mind, it does not come to the person's rescue, is when it leads to suicide.
So there is depression, there could be loss of reputation, there could be loss of loved one, there could be financial crisis, or simply heat of the moment. Obviously, the person is not in fully control of things or himself. Person is not in the right state of mind when these things happen. Which factor do you think, Dr. Manpreet, is most important, which leads to, say, an attempt on actual suicide? No.
Yeah. So of all the factors that have been examined across different age groups, not just kids or young adults or geriatric population, one factor which stands out always is that sense of hopelessness, which kind of partakes every other factor that has been existing. So that point where things are reversible, they are damaged beyond control, and there is no will to fight it anymore. For a while, the person is enduring it, and then it's in a fight mode. And when that hope is all lost, so it's like that pessimism is there, and it's like a permanent pessimism that things are at the point of no return. That hopelessness is the biggest driving force.
And is this hopelessness again a sign of depression, or this is hopelessness can be a normal kind of hopelessness, or which people would experience maybe sometimes when they don't are not able to do things that they want to do?
Right, right. And see, that's a very important factor to consider when we are talking about, and that's kind of the same thing. Sometimes we feel disappointed, we feel discouraged by the situations that we are thrown in. And then we bring in our coping factors or resilient factors, and we pull ourselves through that. So, but when we are talking about hopelessness that can lead us to that point, we are talking about something that's been looming on for not just a couple of hours, couple of minutes, for days altogether. The person has endured it, maybe has tried, desperate efforts to reach out, make connections, talk to people, get some help through with it, use all the mental and, all the pillars that's holding the person together to fight through with it. So hopelessness, it's kind of looming in for several days at a stretch, and after that the person gives up. So, and that's kind of distinguishes between, are we talking about day-to-day sadness, day-to-day disappointments, frustrations we all go through, we all feel discouraged at times, or we are talking about something pathological that's looming in for a longer time with much severe intensity.
So then what exactly is depression, if it is not just day-to-day sadness, Kapil?
Yeah. So see, depression is when you can say, if you were to put it in a common man's perspective, it is like when you are it is a continual state of sadness. It is a continual state of rejection when a person over a period of time, when a person is going through is sad, then he tries up a coping up mechanism. He tries to pull things together. When the person is unable to, again, the person is unsuccessful in that, again, that brings in a new life in sadness. And then the person again, so the point is, when from one attempt to another to the third one, the extent and the intents of sadness in that person, it will continue and it will get stronger. And when it actually gets stronger, that when it actually goes out of the person's hand and the person thinks, well, I will not be able to handle it anymore, is when we can say the state of depression has actually dawned on him. It is right there on him.
So, Manpreet, how would you distinguish between the sadness which we feel normally from day to day, when we feel disappointed or we lose something, from depression now?
Right. So again, it's important to understand that when we are talking about depression, basically what we are talking about is clinical depression. So it's a medical illness. It's not a normal human feeling. Feeling sad is a normal human feeling. We all go through that when there are setbacks in life, when good things happen, bad things happen, kabhi khushi kabhi gham. So that's the sadness. We get into that state and then we can pull ourselves out of it. When we are talking about a medical condition, a clinical depression, we are talking about changes in our mood and changes in our body on a physical domain in a way that's beyond us. So we are talking about mood symptoms, which I know personally that this is not the state that I want to be in, but regardless of all the resources I'm trying, I'm not able to pull myself out of it. So technically, when we are looking at as a psychiatrist, I would call somebody is clinically depressed, I look for a period of time, which is 2 weeks. And the person has that sense of sadness, low mood, almost every day, all the time for those 2 weeks. So we are looking at the stretch of time where the person is feeling that gloomy, sad, down, low, is not able to pull out of it. And in addition, it's kind of a constellation of different things that goes hand in hand to say that somebody is clinically depressed. So other than the mood being low, the other factor is things that used to be enjoyable or things that used to give me pleasure before, they are not tempting anymore. So we call it anhedonia. So loss of interest. And it's not just I am not enjoying it. So there is both, I feel like I can never enjoy it in my life. So what they call, there is apprehensive, anticipatory anhedonia, where you feel like there is just no life left. There is no way I can enjoy singing anymore. There is no way I can enjoy painting anymore. So, and there is like, I don't even enjoy that experience. Even if I'm trying to do it, I don't get the same pleasure out of it. So these are the two things. And in addition, like I said, there are changes at the very basic physical domains, that very basic needs of the body. We can experience change in our sleep pattern. A person may be sleeping too much or sleeping too little. There may be changes in the appetite, where either somebody's overeating or not eating at all. There may be very prominent weight changes that may be evident, loss or gain of weight. One common thing that many patients who are going through clinically depressed state, they go through is feeling of fatigue. So they get tired very easily. Every day they have to kind of drag themselves through the day. And it's not just physical tiredness, they have that mental tiredness too. So simple decisions take forever, like what to eat for breakfast or what to wear for work, what channel to put on TV. whether or not to watch TV, all these small, simple things, there is a mental lassitude with it. And then we are talking about some negative cognitions, negative thoughts that are constantly playing in my mind again and again and again and again. So that's this whole huge constellation of symptoms that we look together, and then we say that it's clinical depression. It's very much different than just feeling low and sad for a couple of hours that I can pull myself out of.
So, Dr. Kapil, please help us understand that, say, we all feel sad now. And so how different is the sadness of depression from sadness that we normally feel? Is it just the duration that if we feel sad for 2 weeks that we should start thinking in terms of depression? Or is it to do with severity also? Is it different, or it's a different kind of a feeling altogether?
I think like Dr. Manpreet, she explained beautifully, it is all at 3 levels: physical, emotional, and mental level, right? Right from fatigue to loss of interest, even in your hobbies, is everything. So it is coming from everywhere that the person is not getting motivated or just wants to be left alone. Vis-a-vis, if you look at sadness, what is sadness? Sadness is temporary. It is something which might be there for some time, and then if you have something which is very interesting, it will, your mind can shift into something which is high on energy, or which is interesting, or which is something that you like of. So when you talk about sadness, sadness is something which is at every level, but like she has also explained, when it becomes intensive, and like I said earlier, when it is repeatedly done over a period of 15, 20 days, 1 month, 2 months, is when accordingly the intensity and the severity of the same would increase many folds. So that is basically what happens when we talk about sadness. For example, one example I would like to, in fact, now Deepika Padukone, she was in depression few years back. Now tell me one thing, a person at the high point of a career, right, still goes into depression. A successful person at the high point of her career, everything is going as per plan, but still she starts losing interest in everything. She thinks that there is something which is not left for her to do, and somewhere a person would think that the person has either achieved everything, or or perhaps there's nothing new happening in his or her life. That is what is another trigger that gets into depression. So what is important is that a person needs to self-motivate himself or herself. That is the point one has to counter. In sadness, one would motivate oneself over a period of time. But when go into the depression, then obviously that energy, that desire of motivating oneself and understanding oneself somewhere disappears.
So can depression happen to anyone, or it happens to only some people, not to others? So is it, so are there some people more prone to it than others, or some people who are completely immune to it? No. So tell us about that part.
So you're asking me?
Yes. Yeah.
Okay. So now in depression, if you look at it, well, there are certain family history also wherein people, they easily get into depression. So if you look at psychology, if you look at the entire science of behavior, it is basically divided into 2 parts, or the 2 parts coexist. It's nurture versus nature. So when we talk about nature, so we are talking about, it can be hereditary, it can be in the family, it is because of the family, the grandfather had it, so the son had it. And if you look at the nurturing part of it, the son saw his father in depression, is when he also somewhere started having this notion that in future I may also get this, I may also catch this. And it goes on to the grandson level. So it can be hereditary in what we call it, what we understand it, but primarily in today's time, more than that, I think it is more of nurturing part of the behavior, that because there's so many things which are going with each one of us, there are so many aspirations, and whenever we get into unrealistic expectations, the people who primarily get into unrealistic expectations, in most of the probability, they're going to somewhere fail is when the depression or the sadness to start with will start knocking their doors.
So, Manpreet, what do you say that? Is it a genetic thing? Is it environment thing? Or is it something that can happen to just about anyone? And we should always be on the vigil to know that what are the signs of depression?
Yeah. Well, nobody is immune to it, regardless of age, regardless of socioeconomic status, education level, gender, you know, how much you have achieved or not achieved. Nobody is immune to it. So as a human, everybody is, there is a likelihood that it can happen. But what makes it more likely? Of course, the genetic risk, that carries a huge part. There is no doubt left. You know, all the researches, they point to that direction, that the genetic risk is about 35 to 40%. And the genetics of a body, that will decide, you know, what I have inherited from my parents. So that is going to decide my biology at multiple levels. That will include the neurotransmitters which are involved in kind of predisposing me to clinical depression. It can also be influencing the hormonal axis in my body, say thyroid problems or adrenal gland problems. So just the basic biology, the structural aspects of my brain. So these are things that I have inherited from my parents, even, you know, just right from the intrauterine. I have come up with this baggage, and that carries about 35 to 40% load in determining whether I'm predisposed or not predisposed to clinical depression. And after that, there are a lot of factors, environmental factors, psychological factors, social factors, and in combination with the genetic factors, it basically determines my risk of developing clinical depression at some point in my life or another. So like Dr. Kapil mentioned some of these psychosocial stressors. And again, important thing is, like, even if there is no psychosocial stressor, that's the ironic thing about depression. Even when everything is right in my life, I may still get clinically depressed. So again, loss of relationships, there is a strong correlation with that in a predisposed person that can cause depression. Early trauma, early childhood abuse, neglect, you know, abuse including physical abuse, sexual abuse, emotional abuse. These are all the things that will predispose. Whether the family has been more nurturing or they're the caretakers that have been involved, that all impacts a person's personality. So again, later in life, just day-to-day challenges based on our socioeconomic status or based on the education, the bullying in classrooms these days, even little children as young as 6, 7 years old, kids I have seen who are being bullied and they come with clinical signs of depression. These days we are living in COVID times, and that uncertainty about seeing the deaths around us, seeing just going in the environment and having that risk looming around us. Loss of jobs. So all these environmental factors, social factors, they add up to a person who may be predisposed more or less than others that can decide whether depression is going to present or not.
It's very easy to understand when there are stresses in life to, you know, to explain depression, or there is a hereditary behind it, you know, and or situations where there, you know. But as Dr. Kapil gave example of Deepika Padukone, where everything was going right and the peak of the career, all set, everything is fine, and still the person goes into depression. And I mean, this is not really uncommon. It's a very common sight all around us, that people who are well-to-do, everything is going very smooth in life, very well settled, or everything going right for them, and they feel depressed. So do you think monotony, and then when everything is all right, there's no challenge in life, also causes depression?
Who
Well,
did
Manpreet,
you
you
ask
can
this
start.
to?
You can start. I can start with you first. You know.
Okay. Yes, I think so. That could be one factor. Challenges is something that gives us some, you know, novelty factor to keep us going. So like he said, once everything is achieved in life, what else to work for? So as humans, there is this innate tendency that we look for some novel factors in our life, the newness in our life, be it like, you know, creating new goals for us, meeting those challenges, and then look forward to what's next. Again, that has to do a lot with our personality style, whether we belong to that personality style or we are we can settle ourselves in our small comfort zone. So again, I think that's a very, it's a, you know, it's definitely a factor that plays a role, monotony. And, but I think that that does not explain the whole, you know, broad domain of it. Like why people who are well-to-do on top, on the superficial surface, why they can still have suicidal tendencies.
Kapil, what do you say on this?
See, depression has a very deep connect with the purpose in life. One. So there are two ways people would get into depression. One is when you lose your aim, or you don't have an aim, you don't have a purpose in life, you don't know how to strategize in life, is when you get into depression, because you don't know what you want to do, and that is where the sense of worthlessness comes in. The other part of depression also is, for example, I'll just share one story that I heard some 10, 12 years back, a very interesting one, that Alexander the Great, he, after conquering everything, he goes to a place, and as he's, you know, going through the forest, he meets a crow. And the crow tells him, well, so there's that water. If you are going to drink that water, you will become Amar. That means you will always remain a king, you will always remain an emperor, and no one will be able to ever defeat you. So as the Alexander is about to drink that water, the crow also tells him another thing. He tells him, listen, I drank that water. I drank that water. After that, all the desires which I had, I've been able to achieve. I'm still the king, but I don't have any purpose left now. So you think twice before drinking it, because once you will achieve everything, then again monotony is going to set in. So the point I'm trying to make is that monotony is something which is another. So one is when we don't have a goal, when we don't have a purpose in life, that also triggers depression. The other is monotony also is another important, not the only, but yes, it is an important aspect where the person does not know. The person says, I keep doing the same thing over and over again. But what is it at the end of the day I'm getting? For example, I normally in my lectures, etc., when I go, I give this example of Sachin Tendulkar. So I tell these people, this guy, that this fellow, he played for 4 decades. He came in 1989, 80s, 90s, 2000 and 2011, 12, 13, he got somewhere retired. Now the question is, a guy who's played for so long, for him, be it media, be it crowd, be it the same cricket ground, be it the same ball, be it the same bowlers, will it not lead to monotony? Of course, yes. Because it may be something which is actually very motivating and new for you and me, but for a person who's been doing it for 20, 25 years, it is something, it becomes very ordinary. Now the question here is, when it becomes monotonous, so monotony is something which nobody is untouched from. Each one of us would be touched in our life. The question is, how do I make my life interesting? How do I go deeper into it, wherein I self-motivate myself, I learn something new? And one last thing, that is the primary difference between, if you look at it, Vinod Kambli and Sachin Tendulkar. Both of them came together. Kambli disappeared in 5, 6, 7 years. Why? Because this fellow, he lost interest in everything. But on the other hand, it was Tendulkar who went on till 2012-13. Why? Because he was able to cope up with monotony.
So now it's again my personal observation that, of course, that we are so programmed in our mind, in our living, that we always need some sort of a challenge and also a capability to overcome that challenge. As long as we keep getting small challenges, as long as we keep overcoming those challenges, we kind of keep going. If we meet up or face a challenge which we are not able to overcome at all, that overwhelms us, we feel depressed. Or when there's no challenge left to be overcome, again it leads to depression. So I feel that life is an extended problem-solving exercise or a challenge overcoming exercise, that we need small challenges, we need to overcome that. Now, what are your views, Dr. Kapil?
So you are absolutely correct. So I see it as we need to create challenges, not wait for them. Like they said, knock, knock, who is their opportunity? Not knock again, who is their opportunity? Not possible opportunity, knocks only once. But we are in the era where we need to create opportunities. When a person gets monotonous, because he is not wanting to learn anything. He's just fixated with whatever is happening in this life, and he's taken that life in his stride, that this is what is going to be my dincharya, this is how I am going to live my life. The question is, what is it? Whether am I able to push myself from my comfort zone? Am I willing to take up more challenges, which is within my work or outside my work, is something which propels me to ensure that things like monotony and depression don't come to me, or I can perhaps delay them.
Manpreet, you mentioned about small children getting depression. So does depression look any different in young children than in older adults and in old age now? So what are the differences, what are the similarities one would see, how to recognize depression in a young child?
Okay. So let's talk about children like say younger than 10 years old first. And the DSM-5, which is basically the manual we use to diagnose depression, it's broadly the same. That's across all the age groups, it's broadly the same. There are some very unique differences which can be assigned to any particular age. So for example, when we talk about sad mood, younger children may not identify, or they cannot articulate, they may not articulate how they are feeling. So instead of feeling low, or instead of saying that they are sad, some of the common patterns, signs that we can see with them is that they're crying easily. They are very easily sensitive and easy, touchy-feely. Sometimes they're very irritable. Many times they're extremely irritable. So small things you say, they take it to their heart, and then there is a tantrum that they throw. So those tantrums, irritability, that could be a prominent sign of depression in young children. Again, the sleep changes that are quite prominent in younger children. Sometimes I do see the bedwetting, or in previously kids who have been toilet trained, they start bedwetting. Night terrors, they start coming in, changing in the eating patterns. So like we said, the sleep patterns, energy, appetite, they are broadly the same across different age groups, but irritability is something that stands out in young prepubertal kids. In adolescents, in teenagers, we often see, instead of sad mood, that gloomy face, gloomy look, they are more argumentative, they are more reckless in their tendencies. Many times they will get into fights at school. Sometimes the sign of going through clinical depression is that they are self-medicating through, say, alcohol or drugs, whatever is going on in their peer group. So reckless behaviors, more fighting tendencies, more anger outbursts, and substance abuse. That could be the prominent focus in teenagers. And then we talk about young adults, geriatric population, where when the sense of sadness, mood, able to articulate their mood, that is developing. So that would be different in the older age group.
So what are the symptoms in, say, people who are really like mature, middle age, or late or old age? What are the signs in them?
So again, the core symptoms are sadness of mood, loss of interest. But even see, we are living in a society where everybody, we are right now, we are wearing that masks, but again, everybody in this society has that kind of Facebook kind of existence where everything looks so great on the surface. And sometimes I ask my patients, especially the adult patients, I used to ask them, so when the spotlight is taken away from you, what is it that you really feel like? When nobody is watching, when no audience is there, when your wife is not there, husband is not there, kids are not watching, colleagues are not there, then what is it that you feel inside? And I remember one middle-aged guy, he would always come, he would always deny when it comes to the mood. His wife knew that there were some changes that is happening in his personality. He himself would shrug it off, call it, his ego or his denial, that he is just so, masochistic, that he does not accept that he is sad inside. But once the audience is taken off, what's the mood inside? So that is, sometimes people cannot pinpoint what is the mood inside. Sometimes they would just say, I don't know. Are you sad? No. Are you happy? No. So they cannot identify it. Sometimes there is a denial that, especially in males, that I cannot be depressed. This is more like a female thing. So there is a denial there. So again, loss of interest, in things which made some sense to me, held some meaning to me, be it in relationships or my work, spending time with my kids, or any other hobbies or interests. That is something that is very common. Lethargy and other vegetative changes that we talked about, they are in middle-aged population, that would be the prominent things to look out for.
Dr. Kapil, do you also feel there is a difference in way the depression manifests in males and females? No?
Well, in males, and see, like she rightly said, that in males there is more sense of denial. It is like that I can't have it because, well, this is how people have been. And one of the other reason is in male, they keep thinking about something. There is some kind of hope and churning, be it office or be it something which drives them to believe that they are not the one who are undergoing depression. Unlike female, especially those female who are basically homemakers, who are at home, these are the people, women who are going to easily identify it because they get that time, and they primarily get time to self-reflect. On the other hand, a man is somebody who is, I would say, notionally preoccupied, thinking that the person is busy and he does not have time. Like she asked a very pertinent question, that when you are not, when nobody is around you, how do you feel? And still people are going to deny, and this is something which happens most of the time. So that is primary difference. A woman is, and there's another thing, ladies tend to, in their home, be it the children, be it the husband, they will always recognize that yes, she's having a lot of mood swings, etc., etc., and the lady may accept it also. Most of the time they will accept it. In case of in men, what happens is, if the children and the woman are going to tell him the same thing, there would be a strong denial, there can be aggression, and there can be something that even before he takes the feedback, he wants to close the lid of that box. And that is primarily what the difference is.
So we talked about what the person feels himself or herself now. And but how to recognize that somebody, some close one in the family, some loved one in the family, could possibly be undergoing depression. So what are the signs which are visible to others? Manpreet?
Yeah. So again, I think the caretakers or the primary family members, they are the ones who know us the best, you know, and I don't like the word pre-morbid, like how somebody was functioning before depression started. Rather, when there is that sense of well-being, we are all aware of the personality of the other person when everything looks great. So that sense of wellness and that sense of optimism or hope or positivity you bring, when you know that part, and in contrast to that, you're going through or you're seeing some changes in your loved ones which look very different. There is a disparity in there. So in that way, caretakers are, you know, they can pick up on, you know, if you call it like a sensitive test, caretakers are the ones who can compare and contrast how somebody was doing when everything was well and now how they are doing. So I lost your question. What was the question again?
And what are the signs in which others, the close ones, can make out that the person could possibly undergo depression now?
Right. So again, some things is, if somebody is articulating, if somebody is able to express themselves, they can come and talk to you and they can say that they're feeling sad or they're feeling gloomy, something is not feeling right. There they are expressing their expressions, expressing their feelings. In little children, the parents can see they are being more irritable, they are having more temper tantrums, they're not able to, you know, they're not able to focus, they're not able to do their homework, like their grades are falling. So these are the things that the parents can pick on. Same in teenagers, changes in personality, getting more argumentative, and everything is ending up in like big conflicts in the house, which was not the personality before. Same with adults, the spouse or the children can figure out, you know, little children can see that my mom earlier, she used to play with me or she used to sit and do artwork with me. Now she is just lost in her own dreams, lost in her own world. They're isolating themselves, they're staying to themselves. So even if they're being, you know, somebody is talking to them, they are just zoned out completely in their own world. So when we're talking about loss of interest, that's also the interpersonal connections. They just want to be left alone. And if they cannot lock themselves in their own room, then this is something that would be evident in their interactions with the people in the family, that they are just physically there, but mentally they are not connecting. So these are the changes that can be seen. But other than that, parents would know if the child is not eating, or it's becoming a constant struggle to feed them, or the little kid is coming to your room in the night 3 times, 4 times, Mama, I'm not able to sleep. So that the change in the patterns in appetite, sleep, the responses, energy level, like overall, somebody, teenagers who may be like totally outgoing and wanting to call friends, wanting to go and just have sleepovers. Now they just don't want to anybody around them. They are not answering phone calls. They are not answering text messages. They are not even on Netflix or other interests that they may have had before. So the guardians can see these changes. Yeah, it may happen very acutely. It may happen slowly over a period of time. But guardians and close loved ones, they are at the best position to see the before and after. So there they can pick up on those signs.
Dr. Kapil, would you like to add something on this? Because why I'm asking this question is that we often hear, okay, so-and-so committed suicide, but the family says he was absolutely all right. There's nothing wrong with him. We never saw any sign of depression. We never saw him feeling sad. He was going very well. Everything was fine. So that means that probably the family did miss something. So what are those subtle things, subtle signs that one should not miss in the close ones? What do you have to say?
See, depression and going to a psychologist or a psychiatrist is still a taboo in this part of the world. And no family member would ever think that somebody in his or her home is undergoing depression. So they would always try and cover up by looking at the positive side of that person. Okay, theek hai, he might be in his own world. It may be 101 more reason. So they always come up with certain excuse just to convince themselves that my child or my child cannot. Primarily I'm talking about children, because no parent, the acceptance in parents that their children have gone in depression is very low. Vis-a-vis, if you are a spouse, so as a spouse, you still might end up recognizing it. But within the family, it is, when it comes to kids, is something that I have normally seen that people are not going to accept it. For example, now I'll just give you, I got a call the other day. Now this was all COVID times last month. So I get a call, just giving you a small example. And the lady says, my husband, he's in depression. He's pretty lonely because it's all lockdown and all of that. So I asked her, I said, what does he do? So she tells me he's a financer. So he basically gives money on loan and he's into share market and all those kind of things. Now, primarily this fellow, he went into his own this thing because all the plans which he had for the next 2-3 months were not getting realized. And since the person was not able to go out of the house, the person
Your mic is mute.
Hello.
Yeah, we can hear you now. Yes.
Yeah, I'm sorry. So I think that is where the person gets into depression, and people in the family, there, from their perspective, it is not easy for them to accept that somebody. But I'll just like to point out another thing. If a family has a history of depression, then still family members, it's a high probability family members are going to take that person to a psychiatrist or a clinical psychologist because they have seen that in their family. But if it is one-off case in the family, is most of the time when they are in a high point of denial. Now, okay, all right, you can go on. You can ask.
Yeah, Dr. Manpreet, so suppose...
Let me add one more thing to it, the discussion we were having. Yeah. So again, Dr. Kapil, he's right about that. There is that denial. Nobody wants to accept that. First of all, I think people take it personally. For them to accept that with the family being dysfunctional, everything being great, one family member is going through depression, that becomes too stigmatizing. It kind of gives me a sense of failure being a mom to accept the fact that my child is going through depression. So that denial is a important thing that may be kind of a blind spot, why I am not seeing the clear signs in front of me. And there comes the role of, talk sessions like this through media or education of people. In schools now, they have started talking about the school counselors are there. The teachers are more careful into looking at the signs in children, not just externalizing behavior, not a kid who is being, running and disrupting and fighting. Other than that, teachers are getting training into looking at those subtle signs where they are seeing some students are being withdrawn or they are not functioning at the level where they have a potential to work on. So yeah, I think education and kind of talking about it as it's like another global epidemic we are all dealing with, the mental health epidemic. I mean, in US, overall, looking at the prevalence, 1 in every 5 people, they are going through clinical depression. They have clinical depression at some point in their life. So that high prevalence is there. But still, if there is a denial, I think part of it is the ignorance and, not being educated to look at it as, a thing that needs, it's thing to be concerned about and get the right treatment.
So if a person feels
yeah.
that he or she has depression or signs of depression, or if somebody feels that some family member or the close loved one has got any signs of possible depression, then what should the person himself or what should the family member do?
Who is it for? Me?
For you, yes, starting with you.
Okay. So it's important to make it not like a taboo subject to talk about. First of all, there has to be, if I am seeing it in myself, I would be able to open up only if I know. Rejection is an important factor. So if I know and bring it up and I am going to be kind of ostracized for that, or people are going to ask me like, how could you, and you have everything going for you. If people are going to be dismissive about it, I would not open up. So first of all, that thing is very important. Like as a family, this is a discussion that happens not when somebody is kind of getting to that broken state. So even for preventive state, even as my little children, I bring it up to them that in some context, in developmentally appropriate, age appropriate ways that they can understand, kind of giving them examples myself that, those were the stages and I went through this, I got help and I'm fine. So again, normalizing it will help the person who is going through depression to talk about it. And also for me to be able to watch for signs that's happening in my loved ones, to accept that, yes, nobody is immune. There is a possibility it may be going on. And instead of assuming or making assumptions, it's good to talk about it and have a clear idea where the person is. So again, after we gauge that will help us see, how far stretch it is. Is it like initial beginning stages of depression we are talking about, or is it more far-fetched where a professional help is needed? So I think that gauging like where we are, that will help determine what's the next line of action.
So in other words, what you're saying is that, talk about this, try to pick it up early. Don't miss out the early signs, say it's like, for example, cancer, that pick it up in stage 1, where it's easily manageable, treatable, easy to handle, rather than before it reaching stage 2 or stage 3, So talking about is what the thing starts with, that if you feel that there's something wrong with you, or if you're feeling low, or if somebody else is feeling low, talk about this in a fashion, in an environment which is open and not judgmental. Does not, don't tell the person that everything is going right with you. How can you feel sad? The person can still feel sad. No, Dr. Kakar, what do you say about this? That early stages.
Yes, in fact, your last question about the family members not taking to the doctor. So these are also somewhere interconnected. The irony here is I have seen many a times that the person gets into the depression because of one of the family members. Because somebody in the family, when they're too controlling, when they're too dominating, is when they push a person into the sense of self-worthlessness. And that is where the person would quietly subside into depression. Now the question is, when somebody goes into that, so will that family member be able to recognize? That family member will not recognize. Will that family member will take that person to a doctor, to a psychiatrist, to a clinical psychologist? No, because the person would feel, but yes, when that person, in fact, the entire thing goes out of hand, when it goes in stage 2, 3, 4, is when the same family member will ensure that the person is taken to a doctor. But before that, it is something like it comes, it goes, and the people in the family, I have seen a lot of times they are also a contributing factor. So one of the thing is, what is the solution? Preventive solution is that apart from giving that confidence, instilling that confidence, telling that person you will not be judged, you are not being judged. People don't go to a psychologist, psychiatrist, or within the family, they don't like to talk about it because they think that they will be judged. So that feeling of judgment, that feeling of that sense of being judged has to go. That is one of the very essential parameters for this.
So, as you said that here, that some people, sometimes some members can be contributing to the state of depression. If not, at least it's very, very sure that if one person is depressed, it affects the whole family. So one should take that depression, whether early, mild, moderate, severe, is not affecting one person only, but the entire family. So it's a family disease. It's not an individual disease. So people should take it as family disease and should work together on it as a teamwork. They should talk about this together. They should try to seek help together. They should try to help each other together. So they should work it more as a team, you know. So what do you say, Manpreet?
Yeah, and let's see, I mean, family is like, yes, it's our immediate circle of protection. Often kids, especially teenagers, you know, no matter how well-intentioned parents are, the teenagers, they still have some sense of, they are more close to their friends or outsiders in a way, and parents sometimes take it very personally, and that's part of normal developmental process in a way. But again, having that open kind of attitude and being non-judgmental, that will help teenagers even to open up and talk about it. So what was the question
So what
again?
you would say
I'm
that, you
sorry,
know,
it's about
so
2
what do you
o'clock
say?
here.
I understand that it's a middle
Yeah.
of the night, you're so slightly,
Yeah.
you know, not just different time zone, but in a different zone you are, you know.
Yeah.
So in other words, the team is not just the
The
family,
team, yes,
but the
yes,
team
yes,
is basically friends.
yes,
So the kin, the close ones.
yes,
You know? So whoever
yes,
is close to the person
right,
should form a team and should
yes,
work upon this as a team, because it's
But
not just
right.
affecting one person, it's
So
affecting the whole
again,
family.
that's important part, even when we are talking about the treatment process. And there is an important therapy which is recognized for depression, which is called interpersonal therapy. And there the main, is it
Just kidding.
somebody, yeah,
Yeah.
some disturbance in the background, yeah. So again, you know, that's an important, it's, family has to be inclusive in the treatment process. And one recognized factor is that interpersonal connections, even between family members or friends, important relationships in our life, that has an important influence on how our mood is or how we are feeling. So again, families coming together and taking their responsibility and accountability for what one person is going through, that can play an important role in you know, deciding whether this person is going to succeed or not in the treatment.
So, say, let us say we found that somebody is having a possible depression, and person recognizes it or the family recognizes it. Then what are the next steps? When to seek professional help? You know? When to go to a psychologist? When to go to a psychiatrist? You know, or when to try to manage things on their own? Dr.
Right.
Kakar?
Okay. Before I answer this, there was another thing I wanted to point out. There has to be an anchor when we talk about preventing, or when we talk about stalling the depression. There always has to be an anchor associated with that person who is going to motivate that person and unconditionally love him. It may or may not be from the family. At times, people are very, very close to friends, at times with family members. So there should not be any compulsion that the person has to be with family together. It is important. The family member, if the person, if a family member, because of who the person has gone into depression, if the person has to be distant subtly from that person, that should be done. One more thing I like to say here is, even in case of children, school children, whatever age they may be, many a times it is the teachers who are dragging them into the slow poison of depression. Not many people will understand it. It is when in classrooms, you have favoritism, you have so many things. You might rebuke a child, and that child, instead of going and telling to the parents, would just go into his or her silo, and there would be an internal dialogue. And then obviously the child goes into depression, because there's a fear, if I'm going to tell my parent is also going to come back at me like like my teacher does. So the child somewhere starts having this hatred kind of a thing with the environment that the child is getting reared in. So that was one thing that I wanted to add.
Right. So basically, like, we can infer from this that people who we can influence not just in a positive way, we can also influence in a negative way. So we should be really mindful that what influence we are having on others, whether it's a negative influence or whether it's a positive influence. No, we should try to make this influence positive, because we can actually bring somebody out of the depression, help somebody out of the depression, help somebody out of the low mood. So we should play a more positive role in the lives that we actually touch. So coming to the question of seeking help. So Dr. Manpreet, who should the family or the person approach, in what condition? When should they meet a psychiatrist? When should they meet a psychologist? Is there any way of family to judge, or the person to judge whether it's a mild depression or a severe depression which would require medication or not?
Right, right. So gauging where a person is, that really depends on the subjective distress that the person is going through. So are we talking about changes in somebody's functioning, which is to the level which is kind of grossly disturbed across the, the whole day? Different domains are affected, not just home, school, also family, also, friend circle, social life, everything is being affected. The person is just not there. Is it like that, or is it like few hours a person is feeling, kind of low, and then you're using all your coping factors and you're able to pull yourself out of it? So it really depends on the subjective sense of distress the person is going through. That if it's like, seems like if it's on the initial stages and you can see that there are some changes, that we can put it in place, more proactive, more pro-health steps that can be taken before things go, or this kind of starts slipping too much out of hand. So if you're at an initial stages where there are some mild symptoms, all these symptoms are there, but they are not that intense, they are not that distressing, and the person is still open to talk about what's going on, the dialogue can happen in the family itself, and the child or adult, they can be convinced that there are few things which you are doing that if you don't do that, probably there is a, things can work out, there can be improved sense of wellness. So simple things that can start at home. There, I don't think we need to just rush into taking a person to see a therapist or psychiatrist. So if it's in the mild stages, like simple, if you look at just the day-to-day activities, if somebody is just not going out, sitting in the house in front of the TV all day, or has no exercise whatsoever, is kind of a couch potato, just watching Netflix all day, and you are seeing that this person is isolating, then if you can encourage that person, like, let's kind of, as a family, let's start doing all these things together. Let's go out for a walk for 30 minutes. Let's start making more proactive efforts into having balanced food in the house. And if the person is open to it and the symptoms are, the person is still functional, the child is still functional, and you can convince them that these are more pro-health measures that you can take, that just improves that sense of well-being. If we can do it in our own house, why not? But if it's beyond that and things are going further, then it would not hurt to, it can even start with a primary care physician, somebody that this person trusts, not a new therapist or psychiatrist to begin with, and just having a dialogue with your own healthcare provider, that you have a family physicians that you are you have had a rapport with for a long time, and you open up and start talking about that these are all the changes I'm noticing, what should be the next step. So there, depending on the severity and extent and the distress that's being caused, I think that's a good starting point, whether I'm at a point where I need medications or just starting with the therapy can be helpful.
Great. So that's a very important insight, that if the symptoms are mild, and if the person is, if you can talk to the person and get him to be, act on his or her health, then do it at home. But if it's slightly more than that, if it's more severe, then try to seek a professional help. And the starting point can be just your family physician. Talk to the family physician, seek their advice, and they might guide you to the right specialist.
Yeah, and again, when we are discussing this with this family member that we are concerned about, it's so important how, the not just the words that we are saying, but also the body language, what we are conveying to that other person. Ultimately, we mean well, we are well intentioned, we want that family member not to suffer through this. So it should not come as kind of a critical thing, or I'm highlighting something that's part of a weakness that you are going through. It should be more like in an empathic way, that I'm concerned, these are the things that are going on, and that makes me worried about your health. So let's figure out what we can do together. So that approach is so important.
One thing I like to add here, which is that normally, even with family members, when they recognize that somebody is slipping into depression or watches the symptoms, it is imperative that at least that family members at least meet a psychologist or a psychiatrist once, so that he is also guided, because it is the first time for that family member also. He does not know how to handle uh, the patient. The question is, so it is imperative that when you meet a psychologist, he's going to help you, tell you this is how your behavior should be, this is what you need to give him space, this is what you need to do, these are the do's, these are the don'ts. So these are very, very important aspect, because if you leave a family member by themselves hoping that they are going to some way handle the situation, more often than not, they just might, the intention would be good, but they just may not be able to do it. One small thing, very recently, I got a call from somebody from Canada, and that person was actually very anxious to know whether his wife has depression or not. And he called me around 6 a.m. in the morning and he says, I just want to find out, these are the symptoms, this is what is happening. And after a half an hour, 40 minutes conversation, I told him, first relief I gave, I said, your wife doesn't have depression, but what you're telling me, if these are the things you're not going to do, she will actually get into depression. So the question is, how do we preempt it? What are the things we do? So the people in the family, even if they want to help, the question is, how do they help? For that, at least they need to meet the doctor once, who guides them for do's and don'ts.
So that's a very important point, that you really want to help your family member or your friend, and you may find it difficult to tell him to go to a psychologist, but in order to help, it'll be a good idea to talk to a psychologist and get some tips and some guidelines in how you can help somebody else. This is just a very important point. No? So,
Yeah.
Manpreet, when do the people need medical therapy or drug treatment?
Again, it comes to the same thing, extent of distress that the person is going through. It also depends on how open somebody is to a trial of medications, So I may see somebody who seems to be in a severe stage of depression, where there are all the vegetative changes that are happening. The quality of life looks very impaired and very different from the baseline. But they may be in a mindset that they are absolutely against trying any medications. So there are some families where there is this hesitation. Maybe somebody else that they know of had bad experience or side effects with certain class of medications. They may not know the details, but even if they know the parts and bits that someone tried antidepressant and committed suicide, they will weave the whole story around it. So there is a hesitance to start medications at first place. I often see that in children and teenagers that I see. Parents are absolutely resistant to even this idea that we want any medications. So again, first of all, gauging families where they are, that's a very important and crucial step to see what treatment modality would work for them. And again, there is a, compared to say placebos, there are the medications that we commonly use, they have an efficacy in about 40 to 50% population. But then there is 50% that do not respond to those antidepressants. And again, there are so many trials which suggest that some of the well-known therapy modalities that we use, especially like say CBT, cognitive behavioral therapy, that has the benefit which is equivalent to the antidepressants. So again, that education needs to be provided to the family, that what are the options that are available. So if it's like moderate depression, which is not absolutely to the impairing level, or suicidal thoughts are not there, if we are somewhere in the middle, families, the ideal strategy should be inclusion of both medications and psychotherapy, along with some pro-health tips, just like exercise, sleep, nutrition, all these things together. So that would be an ideal approach. But again, gauging the families where they are, we should try to meet them where they are, instead of kind of selling that this is what it is, this is the perfection, perfect world, this is how, or idealistic world, this is how it should work. So that more than
No,
usually
because
it never works.
The compliance is more
The compliance
important.
really depends.
More
Yes.
important now.
Compliance
So,
and therapeutic
acceptance
alliance and relationship that you
yes.
can build, that's more important than,
So, Dr. Kapil, see, whether person needs, some people may need drug treatment, others may not, but everybody who has any degree of depression definitely needs an emotional help, a psychological help, or in form of psychotherapy. So when these people come to you, how do you deal with them? What do you do for them?
See, for me, medication and therapy, they coexist. Yes, and they should coexist. When the medication is not being given or not being taken, the therapy at times, if the person is willing and is motivated to get out of it, it works. But most of the time, it does not work, because when somebody is in depression, their own motivation level is not that high that they would actually want to come out of it, because they are just sliding down to the other part. So for me, it is very important that, so therefore for me, a psychiatrist and a psychologist need to work together, even if somebody is on, like she spoke about CBT. Now that's a very potent tool, right? So when you are doing both the things simultaneously is what is going to help you. Now, what happened, for example, again, I'm fond of giving a lot of examples. Yeah. So what happened in Sushant Singh Rajput's case, right? He was on medication, apparently bipolar. We still don't know whether he had, but he was on medication. He could not go for therapies because of the lockdown. Because he could not go for his therapies because of the lockdown, he started distancing himself from medication also. And we know what happened. So therefore, these are like your two legs, which need to go side by side.
Great. So the important message here is that depression is not just a psychological or emotional illness, it also has got a physical component now. And so it needs both the drug treatment, the psychotherapy, and family support, the third part now. So one should not shy away from taking medication, one should not shy away from taking psychotherapy, and one should not shy away from seeking support of the family members or offering that support to the family member who's involved now. I think we have got some questions from the audience. So Anupma, can you help us with that, please?
Yep. Yeah. So I think Dr. Nidhi has one question, and Sonia also has one question in the Zoom call first. So let's take those questions. Sonia, are you around? Would you like to ask your question directly, please? I'm going to unmute you. Sonia? So maybe Sonia is not around. We'll take Dr. Nidhi's question. Dr. Nidhi.
So this is a question for both Dr. Manpreet and Dr. Kapil. Do you think that depression is actually on the rise, or it is just getting unmasked? That's one. If you think that it is actually on the rise, what are the factors that are contributing to this epidemic? I'm not an expert, but I feel like our lifestyle has become such that the things that our previous generations used to do with their hands, with their bodies, which balance the brain chemistry, are now absent, as well as the stressors which imbalance the brain chemistry. the stress of being static at work, the mental pressure of achieving targets, and the social pressure of appearing to be something, as Dr. Manpreet pointed out, Facebook or social media. All these seem to be contributing to why it seems like all this is getting a little out of hand now.
Is there any specific age group that you're talking about? Like it's right, yeah, it is on a rise in general in children, teenagers, young adults, but was there any specific age group that you're talking about?
I think, Manpreet, that I'm talking across the board. Yes, the studies are significant for preteens, that the sooner they get their phones and the sooner they're on social media, sooner these things appear in their lives.
Yeah.
The teen and preteen suicide rates are up by 78 to 90% wherever they have been studied.
High. Yeah.
And more so in girls than in boys because of self-image issues. But, and also because boys would tend to turn to the physical rather than the emotional at that age. I mean, you know, the psychological developments would be such. But do you think that it's actually on the rise because of these things? Are we coddling the brain, so to speak, that, you know, keep getting them to the next class till you cannot get into the next class at the same time, so they don't develop a healthy self-esteem. It's all politically correct. You're very good, bacha, you're very good, go to the next class, you will do better, rather than with tact and age appropriate manner actually set into place certain social corrections in time to at least avoid avoidable depression.
Yeah.
In these crucial stages.
Yeah, it's definitely on a rise in teenagers. I mean, I was just recently reading some statistics comparing 2015 and 2019, and it said there is a 20% increase in reported clinical depression, especially in teenage females. And it was interesting, you brought up the social media part. There was a recent study where they found, they actually university students, and they did this study where university students who were reporting clinical depression, and they looked at how much time they are spending on internet, especially social media. The seven main social media websites, TikTok, Facebook, Instagram, and all that, seven of those were considered. And they looked at how much time kids are spending on these different domains and whether it has anything to do with the extent, the depression, you know, the objective, the rating scales which were there, whether the severity of depression is more if the number of hours spent on the social media is more. And they actually found the correlation, and they found that if kids are spending more than 3 hours on these websites, these apps, their likelihood of developing clinical depression and suicidal ideations would be more. And some of the common themes that emerged was cyberbullying was one of that. The second was that sense of like idealist world and having that, you know, Facebook present worthy life that you want to put forward. And you're seeing everybody is living in their perfect world, but I am the one who is dealing with all this. So that the unrealistic expectation that it puts, that is definitely a very important psychological stress that these young minds are not yet emotionally mature to handle. So yeah, that can explain some of it. Again, another important thing that they found out was if kids are spending that much time or more than 3 hours, some important, you know, requirements of the body, even sleep, that is being disturbed. If kids are not sleeping until 2 or 3 and next morning they are required to pay attention and comprehend what's going on in the classroom, online school. So it's setting all, it's just like a vicious circle. Where to break it, we don't know. So that was an important factor. And you're right about how much you can be politically correct about, you know, correcting some things, that flaws that you're seeing that earlier 30, 40 years ago, they were part of natural life, you know, normal life. And now things are so different. The society is so different. Parents are so much like walking on the eggshells, like should I not? So yeah, societal change at a broad gross level, I think that has a lot to do with I'm not sure if it's more on the surface or it's actually on the rise. I don't know,
All right.
but it's on the rise.
Yeah.
Sonia, I think she's there now.
Yes, I'm here. Hello. Sorry, I think my mute or unmute wasn't working. I have a question. So we've talked about
We can't see
trigger
you, Sonia.
points.
Can you make yourself visible also?
Let me try.
I asked you to start a video, Sonia.
Yeah, looks like
Hello.
Yes.
So we've talked about trigger points with regards to someone's feeling down, someone's lost their appetite, or someone's eating too much, someone's pulling away from the family. What about anger? Is anger a point where you've noticed that somebody is very, very angry or gets angry about the smallest things and then can't drop that? It could be the slightest of thing and they're totally enraged about it. Is that a sign?
What age group are you talking about?
40 plus.
It could be. It could also be. It needs more exploration. You know, it may not be entirely explainable by just clinical depression. I think it needs further exploration to see if there is, based on how severe the rages are, there may be some other factors going on. Bipolar disorders where the mood swings are there, other than depression, there can be extreme irritability, anger, aggression, some other hypomanic, manic features. So I think that needs further exploration.
What is agitated depression?
Menopausal mood swings, sorry, menopausal mood swings, how do you differentiate between those?
Okay, what's the question again? Menopausal mood swings?
Yeah.
Please unmute yourself.
I'm trying to again.
Yeah. Okay. We can hear you now. Yes.
Yeah. Okay. Yeah, during
yeah.
menopausal mood swings and all, then in that also you get irritability, person starts crying and, you know, has a mood, anger and all. So how do you differentiate between that and sort of clinical depression?
So it's kind of the same thing. We want to basically see what's the intensity, what's the frequency, what's the duration. And again, the hormonal changes in females, that predisposes them to mood changes. You know, we see that with postpartum depression. We see that in girls around menstrual cycles, the estrogen progesterone imbalance that happens, that predisposes them to mood changes. Same with postmenopausal. So again, whether it's something that's kind of persistent, it's going on for several days, and just the intensity and severity of it, that will help decide whether it's like hormonal changes that can kind of regulate on its own, or that needs some psychiatric intervention, that needs some clinical intervention at that point. And
earlier you mentioned that in the children, during the teenagers and all, you said that the anger and all was more prominent over there. And whereas in adults, you said it was more of listlessness, the person not being interested in the other. So is the anger also in 40 plus or around 60, is the anger and then bouts of crying and anger, not uncontrollable anger, whether that can also be part of this?
It could be part of clinical depression, and it has to be taken like in context. So I think a comprehensive evaluation, a complete evaluation would be important to see whether it's clinical depression or there could be other factors that may be adding to it. And in again, older adults, 40, 50, 60, when they are having these new onset symptoms, say especially if they have not had any previous history in their life of any mental illness and they now start exhibiting those signs and symptoms, it's also important to rule out any medical pathologies, medical conditions that may be contributing to it. So thyroid problems, adrenal problems, we know about the menopausal changes that happens that can contribute to these symptoms.
Thank you.
okay.
I like to answer your first caller when she spoke about is this being unmasked, the depression, or secondly, is it increasing at an increasing pace? So it is both. In India, it is being unmasked, wherein people have their own coping up mechanism, or with time things used to be okay. But now, obviously, it is not that. Now the question is, why is it increasing at an increasing rate? Is basically there are two immediate reasons that one can see. One is the level of unemployment people are going to, which is also leading into self-worth going down. Because when the purpose, like we have already discussed, and the sector is not in place, the expectations are not being met. That is one of the reasons. The second reason is people who are doing well, they also, and whenever there is a control in the family or somebody controlling them, also leads to frustration, anger, mood swings, and slowly and gradually it takes them into the state of depression. As far as children are concerned, in the case of children, it's a lot of aggression. Like when now, how that aggression manifests. I'll just give you one example. The cases that I have, and this case specifically I'm giving you is of a child in class nursery KG. Yeah, that because that is how you will be able to understand. I had these parents who came to me and who said the child does not sit in the classroom, she just goes out of the classroom, and the school is having a problem, etc. So I heard them, I listened to them for good 15-20 minutes, half an hour, and then I told them one thing. I told them, you change her class, right? Change her section, or you change her school. So they said school changing is a little challenging, but we can certainly ask the school to change the section. You won't believe, within 10 days, within a week's time, the entire behavior, the so-called abnormal behavior of that child, confining herself into the washroom, not coming out, all the tantrums, they were all gone. Now the question is, why are they gone? Because we have to understand behavior comes from the environment. And when you change the environment, in all probability, if it is not an intense medical case, the behavior is also going to change. So I recognize the issue there was not the child's behavior, but it was the teacher. And since the teacher was there throughout the day in a primary section, and the child was not wanting to be with the teacher, and that entire thing changed. And that is something that happens. And when we talk about drugs and etc., that the caller, I found her that yes, she was speaking like a mother, that what happens to the children. But let me tell you, children in today's day and age, they are equally smart. They know how and where to be diplomatic. So primarily, they know how to handle you as a parent, is what I can say. So you think you are concerned about it because she was being concerned, is what I could gather sense out of the communication. But let me tell you, your child is neither diplomat, neither he is subdued. Every mother or every parent would think the child should have more confidence. The child should have more this thing. So that is your expectation. But today's the child, they will behave in front of you for their own advantage or what they want from you. So as a parent, we should also not become anxious about our children if they behave in a particular manner. But yes, the communication has a role. Perhaps we can talk about it in some other chat.
Okay, I have one question.
Yeah,
So sorry, Dr. Nidhi, do you want to ask?
No, go ahead. After you.
So we've had a lot of conversation around child psychology and how depression starts manifesting in an early age. But let's also maybe address what to do when somebody has had a history of depression. They are aware of it. They've maybe been on medication or maybe been in therapy, whatever's worked for them in the past. And then there's been a long phase of, say, stability, so to say. And they might preempt that they might relapse. It could be because of a triggering situation. It could be because of how the environment is shaping up, or because of lockdown, or whatever the trigger is. So the first question is, what can they do preemptively to avoid this, apart from the usual support structures and coping mechanisms that they've created in past? That's one. And two, in cases where they might have in past thought that their depression is resolved because they've come to terms with whatever's been that been the root cause of that long history. If this still keeps coming up, then would you say that the root cause hasn't been resolved, or would you simply say that this is just a condition which is manifesting because it triggers? So A, how they cope with it? How do they cope with it if they preempt a relapse? And two, why is this relapse happening?
So, see, depression, if there is a clinical depression that has happened at an early age, childhood or teenage years, we know that depression is a condition which has a relapsing, remitting course. Sometimes it's a chronic illness. There can be phases where you get clinical depression, you respond to medications, therapy, and you get a remission. That means all your symptoms are gone, you're back to your baseline. Symptoms of depression may not happen for next 10 years, 20 years, and then something happens. Having a previous episode makes you more vulnerable. It increases the risk. And having any subsequent clinical depression episode will increase your risk even more. And it will also make it more difficult to treat you, get you to that remission completely. So again, knowing that factor, I think one important step is that when you're in that stage of stability, when you know the coping skills, you're doing the coping skills, you also have a healthy, not just for physical health, also for your mental health. You're taking steps proactively that can prevent the onset of next episode of depression. God forbid if some stressful situation happens again. So that will prevent you from kind of slipping down the course. And some of the pro-health steps could be, first of all, sleep is so important. Just a very basic common sense things that we often overlook. We don't pay much attention to it, but they are very important to consider to maintain our sense of well-being. So sleep is important. A good night's sleep, not just like, owl kind of pattern where you're sleeping in the daytime and then you're working at night, not like that. So good 7 to 8 hours based on your body's need, you're sleeping that much. If you're not sleeping, then you look into factors which are distractors. It could be social media, it could be caffeine, it could be something else that you are doing, late night things or events or deadlines. Again, looking at your sleep hygiene, basically correcting the sleep. I can't overemphasize how we kind of overlook this very basic requirement of our body. We take it just taken for granted. Sleep is important. Watching our nutrition, what we are eating, that has a lot of role to play in our mood symptoms. So if we are kind of always on the go, we are not settling in, taking time to give our body balanced diet. There are so many studies which talked about processed food, avoiding that, the soft drinks and high sugar drinks. And instead of that, looking into more lean fat or legumes or dals, pulses, more protein-based food, feeding that, nuts and the spices. I was reading about this, there is a big craze in America these days about all these curcumin and the turmeric capsules. But we are coming, our heritage it's giving us all that benefits. But if we use it in a right way, that's also protective. Now, even depression, we talk about neurotransmitters and how they are important to predict clinical depression, but also there is a role of immunology, the inflammation in the body. And the inflammatory markers, they are known to be very high in people who are going through clinical depression. So simple spices that we use in our day-to-day diet, they give that protective benefit against inflammation. So watching our sleep, watching our diet, exercise has such an important role. American Psychiatric Association, in part of their treatment for depression, they talk about at least 150 to 300 minutes of moderate exercise on a weekly basis. So again, social media, we talked about that, how that can be so detrimental to our mental health. Importance of maintaining healthy connections in our life. So it's like, if I know something is being toxic to me relationship-wise, it's my choice to back off than entertaining and engaging with every communication out there. So these are more kind of pro-health measures I can do to avoid the second episode from happening. Again, if the second episode happens, like, the second question you had, Anupma, was if there is maybe a conflict that has been unresolved from the past and something happens that brings it up to the surface again, then, nobody else can know more than the person, especially if the person is intelligent and more psychologically tuned. Nobody else can know it better than the person himself or herself, that this is a conflict that's still kind of is kind of looming in, is the root source of it, and I have not processed it good enough. So there comes the role of a good therapist that you have a rapport with, where you can, basically bring it up and process that particular painful part of your life. Does that answer?
Yep, thank you. Dr. Niti. Yeah.
Yeah, and this is for both of you, Dr. Kapil and Dr. Manpreet. We often hear of people saying anxiety hai, and we also hear people saying depression hai, depression hai. Where would you say is the line between anxiety and depression? Where would a person himself or a caretaker say that now it has crossed the boundary, or are these two completely different things?
No.
Yeah.
Should I go first?
Yeah.
Go ahead.
So, see, it usually goes hand in hand. Depression does not occur as an island or in isolation ever. Mostly there is a strong correlation with anxiety disorders, especially generalized anxiety. In fact, the DSM, the working committee, when they were working on formulating DSM-5, that was one of the biggest questions that they debated about forever. Like, is generalized anxiety, should it be a different domain? Should it be a different disorder? Or should we just, should it be like we said in depression, clinical depression, we have sadness of mood, anhedonia. Should it be like just a separate manifestation of major depressive disorder? So again, it goes hand in hand, anxiety, and especially generalized anxiety and clinical depression.
So
Dr. Kapil.
Yeah. Okay, so how I'll answer this is that, see, in a layman's term, this is what I have seen and realized, that what is depression? Depression is basically a form of lifelessness, which basically happens the minute, like I have been repeating this, when you don't have any aim in life, when you don't have any purpose, when you think you are worthless, the self-worth has gone down, is when a person starts getting into depression. There the idle time has to be very high. Now, on the contrary, what anxiety primarily, obviously that also leads to depression, but what is anxiety? Anxiety is about, suppose a person is overworked, a person is overburdened. There's a lot of things which is happening in a person's life that a person is unable to manage. So in the case of the first case, it was a person has nothing on his plate. And in the second case, a person has too much on his plate that the person can actually handle. And when the person is unable to handle all those things which are coming to the person from right, left, and center, is when the person again gets into a state of hopelessness and helplessness, wherein the person will go into depression. So the root, when a person goes through anxiety into depression, and per se a straight away depression is a little different, because the reason, obviously they both go together, but the reason in the initial state is that the person is somewhere not having the objectives in place. The person does not know what to do with his life. The sense of worthlessness is there. And in the second case, in the case of anxiety, the sense of worthlessness will come when the person would say, my God, all these things together, one after the other, I have shortage of time, I have family to look, I have this to do, I have that to do, is when the person would say, well, I cannot do it. So that is where he will start getting into the path of depression. I hope I have answered you.
And there is a very interesting thing about repetitive activities creating more chemical balance. Say in the olden times, people used to recommend knitting, dancing, or cooking, because these are the activities which create a chemical balance. Or even art therapy, what it is doing now. So do you recommend these things?
Dr. Manpreet, I think you can start with it. Yeah. Or you want me to start? Whatever.
Engagement with any of productive things, whatever brings you joy, that's always something that can break away, or that can break that kind of chain or cycle of ruminations in your mind, the negative cognitions that you are kind of consumed in. So having some medium of expressing yourself creatively, whatever it is, be it cooking, be it knitting, screwing, you know, whatever it is, singing, dancing. So whatever it is, that is kind of an important distraction medium. So I think in that way, it can definitely help.
Okay, I think, yeah, I just answer. So yes, what you're saying is perfectly right, that it has the impact on your neurons, your happy hormones, happy neurons. Why? Because you're doing something that you love to do. With this, so you obviously should do this all the time. Apart from this, I'll just suggest three things, very simple things. One is, we all know, it is meditation. Even if you can meditate for 15, 20 odd minutes, that is going to help you. That gets the semblance back. And normally when you meditate, what you need to do is, if you want to reach the state of mindlessness, thoughtlessness, whatever, when you sit for meditation, let the thoughts come to you. Don't stop them. Don't fight with them. But don't let them penetrate also. So what you need to do is, you need to just observe them. Once you observe them, you will see within 5, 7, 10 seconds, they will disappear and a new thought would come in. And this is the cycle. When you start a meditation process, once you get over this the stage of a highly working mind into a stage of mindlessness, that is going to give you a lot of peace. That is one. Second, I would also, apart from your hobbies, I would also suggest you auto-suggestions, things like visualizations. So what is auto-suggestion? Auto-suggestion is, when you get up in the morning, when you're going off to sleep, say good things to yourself. And it should not be, I will be happy. It is, I am happy. I am at peace. So also it is as if it is happening to you. So what are you doing is, you are somewhere auto-programming. So it is like a self-therapeutic thing that you're doing by yourself. And the third is visualization. So visualization is every day, just apart from meditation, or you can do it, that just sit in silence and just visualize how did your day go, or how you want your next day to go, or if you're doing it in the morning, how do you want it to go. Look at for the good things, and that is how it is going to have a good impact on you over a period of time. But don't leave your hobbies. Hobbies are the essence.
Great, fantastic. So I think we had a very wonderful conversation over here, and I'd like to take this opportunity to thank both my guests. Dr. Manpreet, thank you very much for staying up middle of the night to talk to us. Dr. Kakar, thank you very much for taking time for this chat session. I know you're a very, very busy person, and thank you, audience. But don't go away. We've got some announcements to be made. So next week we have very interesting topic coming up, and that is how to compare, how to anchor, how to be an RJ, how to be an MC. And we'll be joined by two very important anchors now. The RJ Megha, who is very reputed RJ, who MCs various prestigious national events. RJ Aparna, who is with All India Radio, the FM Gold, and of course I'm your Desi RJ too, so I'll be there as well. And three of us will tell you about how to RJ, how to be a good MC, or how to be a good anchor. That is next week, same time, same day, next Sunday, 11:30. Don't miss that opportunity. And thank you all for being part of our lovely group, the live chat. Stay active over there, keep it vibrant. I also want to thank Anupma, who always helps us in the background with taking the questions and managing people's flow. And once again, thanks everyone for participating, for being here. See you next week. Bye-bye. All the best. Have a great time. Stay happy, stay cheerful, keep everybody else happy. Whichever life you touch, make sure that the life is, get something positive from you. Bye-bye.